Hi, my name is Cindy Ramos, and I will be talking about penile cancer. I hope you learned something from my presentation. Throughout my presentation, I will discuss what is penile cancer risk factors, penile cancer statistics, the signs and symptoms, treatment, and prevention. First, I'm going to start by explaining what is penile cancer. Penile cancer develops when cells on or in the penis begin to grow uncontrollably. It's a malignant growth that affects the skin or tissue of the penis. However, not all of the growths on the penis are cancerous. Some of the growths may be warts that are usually benign. There are different cells in the penis, so therefore there could be different types of penile cancers. These type of penile cancers include squamous cell carcinoma, which is a cancer that usually affects the squamous cells and develops under the foreskin and develops slower, so it may be curable. Another penile cancer is melanoma. Melanoma is the most dangerous of the penile cancers because it grows faster and it spreads quickly. Basal cell carcinoma is a small portion of the penile cancers and also develops slowly. Adenocarcinoma is rare and develops in the sweat glands of the penis. Only a small number of penile cancers are sarcomas. These cancers develop from blood vessels, smooth muscle, or other connective tissue cells of the penis. Penile cancer risk factors. Having a risk factor does not necessarily mean that someone will develop cancer on the penis. One of the risk factors in developing penile cancer is HPV. HPV can affect the genital area and may become a chronic infection that may lead to penile cancer. HPV is one of the main reasons why men develop penile cancer. Another risk factor is not being circumcised. Not being circumcised may make it easier to contract the HPV virus and may also lead to the development of phimosis and smegma. What's phimosis and smegma? Phimosis is a condition where the foreskin of the penis can't be pulled past the glands, and a balloon-like swelling under the skin may be present. Smegma is the combination of skin cells, oil, and moisture. Other risk factors include smoking, UV light treatments, AIDS, and age. The chemical from smoking travel up the bloodstream and can damage the cells of the penis. People who have HPV and smoke have a higher risk of developing penile cancer. Penile cancer statistics. There are 2,030 new penile cancers that are diagnosed each year. Out of these 2,030, there are 340 deaths. Penile cancer is in 1 man out of 100,000, and it's 1% of cancers in men in the United States. 63% of penile cancers come from HPV, and it's more common in Hispanic men than in non-Hispanic men. Signs and symptoms. There are different signs and symptoms that could be from penile cancer. Not all signs and symptoms, however, are caused by penile cancer because it may be caused by other conditions. Some of the signs and symptoms that you should look out for is a lump on the penis, ulcers or sores that may bleed, crusty bumps, smelly discharge that comes from under the foreskin, swelling or lump in the groin area. If any of these symptoms appear, you should visit your doctor in order to see if it's penile cancer. Treatment. In order to diagnose penile cancer, a medical assistant may do a physical exam and medical history. Then they will perform a biopsy to stage the cancer. The treatment depends on the stage, overall health, and personal preferences to the side effects. Some of the treatments include chemotherapy, radiation therapy, surgery, local therapy, and alternative methods. Some of the alternative methods that people prefer over the most intensive procedures include herbs and vitamins. Prevention. Penile cancer cannot be prevented 100% because there's no specific reason why it may develop. In order to reduce the risk of penile cancer, however, is by using condoms in order to prevent you from getting the HPV virus. Getting circumcised is another way to prevent penile cancer because you can't develop phimosis or smegma. Good genital hygiene, abstaining from smoking, and receiving the HPV vaccine are other ways of preventing penile cancer. This is the end of my presentation. These are the resources that I used to help me with my research. I hope that you found this very insightful and interesting. Thank you.